Welcome to Amazing Grace. This show is dedicated to the idea that active, informed older adults are an essential part of today's society. We provide information regarding senior issues and concerns and salute individuals or groups who demonstrate that productivity doesn't end at retirement.
Welcome to Amazing Grace. I'm really glad you tuned in today. I am Denise Robinson. We're going to talk about an issue that touches every single one of us. Are we taking prescription drugs? Are you County Executive Barry Grossman? Are you Patty Puline from the Erie County Department of Health? Denise Robinson, are you? The answer just might be yes. What we're going to talk about today is prescription drug abuse. Now, prescription drugs are what is the common denominator. Abuse is the very scary word. And the fact that this problem is so great in Erie County that we have our #1 county official with us says, I think, how important this is, how serious it is, and it's a problem that's escalating. Barry Grossman, thank you for being with us. You have an awful lot of fires going on at the courthouse.
I do.
So for you to join us here to talk about this tells me a whole lot about
Let me say first, Denise, I couldn't be prouder to be sitting here with two of my favorite women in Erie County. You, who were the initial first lady of Erie County, who, along with your late husband, Robbie, exercised that position with such grace and such style and civility.
Thank you.
And Patty Puline, who I've known all my life, who brings more passion and energy to her job than maybe any of our 1,300 employees. So it's an honor for me to be here with both you strong, dedicated women.
Thanks, Barry.
You know, I always thought PDA meant public display of affection.
From West Point
and that's a good thing,
Annapolis.
I guess. But what we're talking about is not such a good thing. One of the leading causes of hospitalization for young infants up to 4 years of age, I think it's the second leading cause for hospitalization. It's the third among people over 65. So you see that this particular malady is very difficult in terms of dealing with infants and elderly when people are less able to discern what they're doing. Mm-hmm. And we think of the drug problem in America, and Patty will fill everybody in more as we go along. The drug problem in America is not just cocaine, marijuana, and heroin and all that, but the things that we think are good drugs.
Yes.
And they are good drugs when used properly. They're not good drugs when they're used accidentally or without the guidance of the physician's care. And in our homes are like little time bombs.
Well put. And that's the problem, isn't it?
That is the problem.
Barry mentioned, County Executive Grossman mentioned to me that you had a personal experience of prescription drug abuse in your own household. Can you share that with us?
Yes, I did. It was quite scary. My mother-in-law, who was elderly at the time, was staying and watching our young grandchild. And I think at the time he was about 2.5 years old, so he was mobile.
Busy.
And obviously had hands and things like that. And when she came in the house, she did what a lot of people did. She took her prescription drugs out of her purse, put it on the kitchen counter. And before we know it, we walk home one day, the pills are open, they're laying out, and my wife gets hysterical because we could see they'd been consumed, and we had to rush the youngster down to the hospital, have his stomach pumped. And fortunately, he was fine. But it alerted us to what an easy thing this could be, where people could incur drug poisoning inadvertently because of the careless possession of prescription drugs.
You bring up something that we focus on with Safe Kids, and that's called What's in Your Purse.
What's in your purse?
It's just a poster that you put up so that people can say, what's in your purse? When we go to visit each other's homes, you have your purse.
Right.
Put your purse in a safe place. Put it in a closet, put it up high.
Right. And it's not, Denise, just youngsters and elderly. The other group that concerns me a lot are teenagers. Teenagers are at a point where they want to take risks, they want to experiment, they want to do what they think are cool things, and one of the places they go is the medicine cabinet. And they think, oh, well, I'll take mom's painkillers, or I'll take some of dad's cortisone pills, or these kind of things, and see how they feel. So there's a lot of teens, and teens, as you know, is the subject age for suicide. So this is like a loaded missile in your cabinet. So we have got to make people aware of the dangers in our own homes.
That's something that ties in with what we're doing, and I'm glad the county executive brought that up. One of the key points, and it's a 5-pronged approach, a comprehensive approach, is to go into schools, middle school, high school, and even colleges, and give classes on prescription drug abuse. And he's right. They find them in the medicine cabinet, from family, from friends, and any prescription drugs. When you think of prescription drugs, you're probably thinking of opioids, and that's part of it, benzodiazepines, but a lot of teenagers are on Adderall, and that is significant abuse among some of...
That's a stimulant.
It's something that they take to control ADHD, but that has turned up to be abusive, and he's right to say that teen suicide is happening in Erie County, and we see that. When I audited the 4 years at the coroner's report, we did see suicide tied in that age group to overdose deaths.
I have a funny story. I don't remember if you remember Joe McClellan.
Oh, sure.
He was a cardiologist in Erie, and really one of the smartest people I've ever met in my life. This guy was a brilliant human being, a brilliant physician. And I saw him for a while when he was practicing, and he always talked about prescription medicine. He said, you know what a prescription drug is? I said, what is it? He said, it's a sublethal dose of poison.
Whoa.
It's a good description.
Yeah, very good.
Lethal dose of poison. And we ought not, everybody distinguishes, well, those are street drugs, those are bad. These are good drugs, I get them at the drugstore. Well, nothing could be farther from the truth. All drugs are inherently dangerous when abused, when used improperly, when mishandled, when taken too much of. So we can't think because there's a doctor's name and a drugstore name on the cover that we're not dealing with something very dangerous, just like a pistol would be in a home.
Yep. Right on.
Yeah.
That brings up the prescriber survey. We actually did a survey this year, and we'll do a post-survey in 2013 from prescribers, such as the physicians you're talking about, dentists, PCRNPs, to say, what kind of a problem do you think we have in Erie? Do you think there is a problem in Erie County among prescribers? And there is. We found that during the take-back days, we did an audit and logged the results of the take-back days. Those are held in April and in September every year. What was revealing is that some of the pills that had 30 pills in it as a first fill still had 25 pills in the bottle. So there was over-prescribing. What happens to the rest of those pills? They go in the medicine cabinet that he's talking about.
Yes.
So that's why we want to see if we can enlist the prescribers as allies in the fight against prescription drug abuse. We are providing them with education and professional training.
Patty, you just mentioned take-back days for prescription drugs. Can you explain that to those who are watching this show?
Sure. A drug enforcement agency oversees the national take-back days, and they are in April and September. We participate in Erie County by having those in various areas, Mill Creek, Harbor Creek, the city, and we do that in partnership with LECOM, School of Pharmacy.
Right.
People can bring back their drugs, turn them in, they're logged, all the controlled substances are logged, everything is put in containers, we ship them off to Ohio, and they're incinerated in Ohio. Now we have, thanks to the county executive, 4 med return units, so every day can be take-back day.
It was kind of interesting.
Marvelous.
It's kind of interesting. Denise, Patty, and every time I get a call from Patty, I know it's not about something light. Patty is intent on getting something done,
intense.
which I love. Believe me, I love it. And she said, "Help me! I have to get them here. I got to get them there. I got to get them here." So she was having particular with one location. So I said, there's a solution to that. She said, "What's that?" I said, "Let's put it right in our courthouse." Oh, she said, "Could we?" I said, "Nobody visits there are no more number of visits than to the Erie County
That's
Courthouse.
This was
exactly
For
right.
dog licenses, for marriage licenses, for a million functions.
Voter
Now,
registration.
Voter registration, on and on. You walk in the front door now. Besides the screening devices, right there on the left is a med return unit. What it looks like is a mailbox. It looks just like a mailbox.
And it's there every day?
Every day, and it's the first thing you see when you come in. And it's so funny because, I haven't told Patty this, but I go down frequently and talk to the sheriffs who man that, and I say,
Yes.
I said, do people come in? He says, all the time. They come in, they have stuff in their little bag. Nobody asks any questions. You drop them in, you walk away.
Do you
Leave
know
them right
who
in the
will be
bottles.
there tomorrow?
Denise Robinson.
I
Robinson.
will. I will be there
And that's what we want to get out. We want to get the message out that, hey, you can bring them back anytime. You don't have to worry. It's totally anonymous. And we've already emptied that once. We had 5 boxes filled to log
Right.
in 1 month.
I didn't know that.
And there's a big environmental impact as well. I mean,
Oh, it's
because
not going
a
into
lot-
our
A lot of
lake and
people
our
think, I'll just
bay."
throw this in my recycle bin. No.
Or down the
Or down the
toilet,
toilet,
not
any of
down
that.
the
No,
toilet.
you are not only helping to prevent a horrible accident, you're protecting the environment. I think it's one of the great things you can do is to bring these down, drop them in the mailbox.
That's on my schedule for tomorrow. Where are the other 3?
There's,
Yeah, there's one in the Corey Police Office.
Oh, good.
There's one in the Girard Police Office and one in the Edinburgh Police Office. I believe, if I'm incorrect, that they have to be placed in an area associated with law enforcement. And I don't want that to intimidate people. It's not because anybody's looking over your shoulder, hey, what drugs are you dropping off? It's just that we want to make sure that they're well protected.
We have an abuse problem here,
Right.
so the fact that they are protected is very
it's a
wise.
DEA regulation that we have to follow because people think, well, I can just take it back to my pharmacy. And the White House really has a policy that in October 2010, they passed it where we will eventually be able to bring our drugs back to the pharmacy, but they haven't written the guidelines for that yet. So once those guidelines are written, our med return units will still be able to be in use, and we can either keep them at the police departments we have now, or we could choose to take them to a pharmacy where people will be taking back their meds.
And this is a bigger problem because I believe it's every week that I am reading in some newspaper that some pharmacy has just been totally robbed of all
absolutely.
of their major drugs.
OxyContin.
So until they are secure, putting them right with law enforcement or in the courthouse is a very wise plan.
Yes.
That is very proactive.
Well, we're working with pharmacies, Denise. We actually designed a flyer, sent it over to be approved, and now we have flyers at every pharmacy. Take back your drugs, take back your drugs, take back your drugs. And all the physician offices, we're promoting environmental change by going right to the prescribers. So when they're prescribing drugs, they know, their staff says, oh, we have a flyer here that says, I didn't know we could take back our medication right here. So every day is Take Back Day.
Absolutely wonderful. Now, tell me about your comprehensive partnerships.
Oh, yeah.
Because I am thinking, when you're talking about the prescriber survey and trying to get your prescribers to be more in keeping with only prescribing what is actually needed with the number of refills that may be actually needed, is that going into the LECOM classes for new physicians?
The LECOM School of Pharmacy.
Perfect.
And Barry?
Yeah, well, you were talking about the collaboration, and I think it's an important part of this is not just being done by Erie County. We have lots of partners in here. The district attorney is involved, the sheriff's department is involved, the city police, all the boroughs, they're all involved. The public defender's office is involved. Our drug and alcohol agency, which is headed by John DiMatteo, is involved. LECOM is involved, and of course the health department. This is an amazing partnership, and everybody's cooperating, everybody's chipping in because they've all been touched, all these agencies, with the immense problem of the improper use of drugs.
Tell us how bad the problem is, Patty.
Well, we're talking about kids, but I also want to let you know that we have a problem with seniors, we have a problem with teenagers. You might not think of seniors as being at risk, but they are. We do a senior program called MUST, a program to help medication management for seniors because they might get confused.
Okay.
My own mother got confused about her meds because she had dementia and she had Alzheimer's. So I had to check on her every day and count her medications. This is a program that we are presenting to senior agencies and to nursing homes so that they can understand their medication